back to Unraveling the Brain. I'm Dr. Lauren Liming with our amazing therapist. Those of you who know Miss Abby, you know she's amazing. Miss Abby here. She's been here around the same time I started, and her and I just want to get on here and talk about the things that we've seen improve, or the kids that we've seen improve using the green laser in clinic. We've both been here for years and have seen hundreds, if not thousands of kids, and then just have a really diverse experience with kids with all different developmental abilities, all different developmental backgrounds. And lasers are cornerstone for the services that we provide in the clinic. And we've been demoing a green laser for almost 2 years here. And when we started using it more, I feel like the staff almost started fighting over it. When I mentioned green laser and Kyle asked, hey, we've got to film this and get some exposure and teach other people about this. One thing I thought is, oh, Miss Abby's got to be on this. And you're like, hey, if you thought I could be in on this, I'd be happy to. What is your perception of green? What makes it different? What have you noticed? Just observationally, as a therapist working with so many kids, what does green do?
Yeah. I personally love the green laser. I think one patient stands out in particular to me of we had been working for a few days just on a bunch of different things. And this patient in particular struggled with just emotional regulation. Transitions were really hard. Everything was just a battle. And use a green laser almost primarily for one day. And then the next day, parents were talking to me. They're like, I don't know what you did, but last night we had such a good night. He's talking more. He's able to regulate more. And then after that, it wasn't necessarily smooth sailing for our therapy, but it was so much better. We were able to transition into rooms instead of needing to stay in one room the entire time because he couldn't transition out of it. We were able to do activities that we had never been able to do, which then furthered our care to make it better. I love it. That was a selling point for me to see just the night and day difference within a day of using it.
So that's a detailed example. Generally speaking, we see it just help kids calm down, right? Yeah. And we saw that a lot when we introduced the Violet in the clinic. We've been using red and infrared with a lot of success, and the Infinity was seeing a lot of really profound changes with kids. And then we started using Violet, and we're like, wow, this is really effective in its own way. And then we started using green, and we started noticing that calming effect that it was able to provide. And the mechanism, and the more we use things, the more we observe, that means a lot. But then also really understanding what this does, at the cellular level, what this does to the body. Green laser, so laser being, or green being the visible wavelength, the spectrum of light. The wavelength is the distance between peaks and valleys of a laser. Green is just a laser that's in the 520s, 530s. This is 532. Green laser is really excellent in allowing hemoglobin to more appropriately deliver oxygen. So we use green in areas like the carotid arteries, or scanning over the body. We'll use it transcranially because there is some degree of penetration. But when we use green, we allow kids to receive more oxygen to their brain, or deliver more oxygen to their brain. That's always going to be a good thing. And I believe that's the mechanism where we see that calming effect. And there's also some big anti-inflammatory effects of green. There's some cell level stabilizing effects where this actually helps stabilize red blood cells, helping promote helping promote nitric oxide. And nitric oxide is a great vasodilator, so that helps more blood flow to the brain, and then you're delivering more oxygen and more blood flow. So that's really cornerstone for our care model, where we're working on these really fundamental pieces that a lot of other clinics are missing in, helping kids with energy production in their brain, helping kids with decreasing neurological inflammation using photobiomodulation, using hyperbaric oxygen, using supplemental oxygen, looking at functional labs. And so when we have a tool that helps deliver more oxygen and delivers more blood flow, that fits right into the Infinity care model. What is your overall perspective of laser therapy in general? And that's a very open-ended question. When we check out lasers as a staff, Miss Abby's always got first dibs. She's one of our senior therapists. Or really our therapist has been here the longest, right?
Yeah.
And so I'm always amazed by the results that you get with your patients. I'm always amazed by how well you're able to relate to everybody, and just you're a great assist, you're a great lead. So what is your take? having that background, what is your take on laser therapy in general? Like where does it fit in neuro rehab and supporting kids with developmental delays?
I love it. It's like you said, it is the cornerstone for what we do. We see kids all of the time that they've gone to OT, PT for years trying to get rid of primitive reflexes, right? Like that is the cornerstone of what we do. Getting rid of primitive reflexes so that the brain then can develop more appropriately and like start to work more like effectively together, that we can actually have the brain work together in the way that it was designed to. But before we can do that, we have to decrease inflammation. We have to increase energy production in the brain and in the body. And that's where the lasers come into play. You can rep out activity after activity after activity to get ATNR, STNR, sensory reflexes to go away. But until you actually support the brain and the body at a cellular level and an energy production level and decrease that inflammation, then we're not going to go anywhere.
It takes way longer. Yeah. It's way more effort for the kid, and it wouldn't be realistic in our care model to help. If we only see kids for 1 to 4 weeks at a time, and we don't have technology like this, and I don't think we wouldn't be able to get the results that we get.
No,
there would be no infinity. And so I think Dr. Josh, he started using lasers, admittedly, before he really understood how they worked and really understood the dosage. But quickly, and as brilliant as he is as a doctor and a clinician, as much as he's into the research, like we've adapted as a staff. Like, hey, this has been really effective with this case, and we're always talking. We're always brainstorming and focus grouping on what's most effective to help kids. And I believe, and I know that when we introduced the green, there was like a change, like in the staff, like, hey man, that's pretty cool. The thing I love about this, and obviously the videos or this podcast is about this, but it also has infrared. And when you look at the body of research related to photobiomodulation using laser therapies, especially over the brain, infrared is the wavelength. Like it's 80, 90% of the research out there. And so this laser contains that wavelength that we know is beneficial for the brain. We know is actually getting to the brain effectively, efficiently, safely. Infrared over the brain has been around since the 1960s. And so people are like, oh, I have these concerns. It's like, well, it's safe. It's been around a long time. It's energy, and that energy helps the cells function, and it helps makes the brain healthier. And I always say these aren't the cure for anything, but they help everything. And so whether it's, a kid with a neurodevelopmental delay, a person with stroke, cerebral palsy, neurodegenerative conditions, when, like you said, we help the brain make more energy at the cellular level, and when we're able to decrease inflammation, those two big picture necessities, the good things happen to the brain. And so having infrared to have that deep transcranial support, like, hey, we're getting to the brain efficiently. We know it's getting into especially this wavelength, 808 nanometers. We know that the infrared wavelength was one of the wavelengths that built the office.
Yeah.
So we're talking about something new, but we're also talking about like Old Faithful. Like
when I started, we had 4 infrared lasers, and that was it. Yep. Now out there we have, I don't even know, like 20.
And you asked Dr. Josh, hey, what's your favorite wavelength? I love that question, by the way, because I'm a nerd and I'm a laser nerd, but he's always like infrared. And so this has the infrared, but it also has that new green where we see that calming effect. We see that regulating effect. We see that vasodilation, that oxygen delivery to the brain. And so it really checks a lot of boxes. And when you look at, I opened this discussion talking about the wavelength spectrum. Infrared and green are very different from each other. And so in one device, you have 2 wavelengths that complement each other very well. It's not just things that are close, and those lasers are great. Like the clinic has been built upon wavelengths that are close, red and infrared. They're pretty similar. But infrared and green, we just bridge that gap between, or we actually open that therapeutic biological mechanism by having a wider span of wavelengths. And I love that.
Yeah,
and so,
the benefit.
Yep.
Yeah, I think going back to kind of what you were talking about, that like when we first introduced violet in the office, it was like night and day difference of like just increasing GABA in like the body and then the brain in these kids and just like calming them down. But I love the infrared and green laser because, like you said, it combines infrared, which is a cornerstone of everything that we do. So it actually penetrates through the skull and makes an impact like to the brain. And then you combine green, which is very similar to violet in how it calms the body down. And you went into a lot of great detail of what green actually does. So you combine the opportunity to help with infections and different stuff like that, along with that infrared that was what our office was built on.
Yep.
It combines two things that are very different but need to be together to make a lasting impact, in my opinion.
I like that comparison to violet, and we can also compare it to red because green is in between violet and red. So it has some properties of both. Like they're all unique in their own ways, but green is close to violet. It's close to red. I think of it as a great blend of the two.
Exactly.
I think red kind of gets overlooked as far as the value because it's like Old Faithful. It's always there, but red's been around a long time. Red's great for mitochondria. Like the body loves red light. And so this is nothing against a red and infrared laser. This is saying, hey, for some people in some cases, and a lot of times, like if we just discuss like with a parent, like, hey, we have some really big behavioral issues or emotional outbursts or meltdowns or transitions, as you touched on, if those are really challenging, sometimes I'm like, man, I really want to use that green laser, calm things down, and then have that infrared long-term that we know is going to be beneficial because the feedback I get from parents that have that infrared long-term, those kids just like keep doing better. And so we use different wavelengths for different periods of time. If I had to pick one wavelength for everyone to have forever, it'd be infrared personally. But I like the complement of green because they're different, and what green actually does is really cool, and it's really interesting. I was taking a webinar, and this is like totally not related to what we use it for, but actually even liquefies fat cells. And so I don't know, and I was thinking of that as from like a developmental perspective, like, man, if we could use this over like dermal tissue or like fatty tissue, let's say like my belly or, underarms or something like that. And then I do something cognitive or I do some neuro rehab. I'm like, hey, there's some like fatty acids for my brain to then convert to energy. I'm like, that's pretty exciting. Or like my body to convert to ketones and then my brain can use that for energy. And so I'm thinking, okay, like if we're telling kids to eat low sugar, low carbs, like they need to be able to mobilize fat and make that into ketones and turn that into energy. I'm like, I wonder if this would be like a good way to do that. Like just like before a session, we always start with lasers, or we often start with lasers for sessions. Like, should we do that over, fattier tissue, upper arms, like in the arms, like over the belly? Yeah. It's like that's where my head goes with things. Like, how could I take something that, a lot of people are using for cosmetic value, and some people might find the cosmetic value in this. Like, hey, I want to spot reduce some fat. Like, that sounds pretty cool. But for me, it's like, okay, what can I take that mechanism and apply it to help kids doing neuro rehab? And like, that's what I'm interested in, obviously. So things we like to use this for, like I touched on it. Where would you use a green laser? So not just the infrared. Where would you point green, or where did you use it to help that boy with regulation and help therapy go smoother?
Yeah, my primary area that I use it, and you kind of touched on it, is the carotid arteries. Since it doesn't get as deep as infrared, that like those carotids are the primary that I use violet and green on. On that kid, I did use green like transcranially everywhere as well, and he responded really, really well to it. With that, I think it goes a little bit deeper than violet, and so like that is also a big reason why I love it, is because I feel like we can get similar benefits but also going deeper with that laser. And so I used it transcranially a lot, but on carotids is primarily where I use it, and then gut as well.
Cool. I think obviously carotids is great. So we are with carotids. That's a blood supply to the frontal lobe. And so getting more energy, more oxygen delivery to the frontal lobe is going to be a great thing. I'm wondering if, just thinking about this and thinking of my research on green goes right through the skin, where violet's more absorbed by the skin. Green goes through the skin and it can get to those more superficial nerves like like the vagus nerve that runs like intertwined with the carotid artery. So when we're lasering the carotid arteries, we're getting that benefit of blood supply to the frontal lobe, but we're also getting that neuromodulation effect of the vagus nerve, which is a good thing for everybody. And you were talking about, you had a kid that's really hyperactive at lunch today, and you're like, hey, we got to start with some vagal stimulation.
Yeah.
I'm wondering if our patients that we've seen that regulation effect is because we're getting vagal nerve stimulation in a really non-invasive way. Because green goes through the skin, it can get to those more superficial nerves. There's a lot of versatility with green too. And from my research too, there's an immune modulating component of green, where we see a lot of kids with neurological autoimmunity, chronic infections. And so having that mechanism of green also is really, really versatile. I've seen some things with one of the markers we see on neurozoomers very frequently is an Epstein-Barr infection, or it's not a current infection, but we're still making antibodies against Epstein-Barr. It's a really chronic thing. And that can create a lot of stress to the cerebellum, which we often see is highly involved in kids with developmental delays. And green is very good for actually decreasing the viral load of Epstein-Barr. So if you've run a neurozoomer, if you've seen that Epstein-Barr or those Epstein-Barr markers on there, green has been really effective. And I need to find that study again, because I always find these things and I hang on to them and I conceptualize them, but I need to put them in a spot where I can go reference them later, because this place isn't safe for any information.
Something after reading it one time.
It's just, for me, it's like the dots I can connect. Okay, Epstein-Barr. Okay, we see that a lot. Okay, I'm not going to forget this now. Mm-hmm. Green's super cool.
It is. It is really cool.
This is kind of a joke in the office. I know this as infragreen. What the green machine?
Green machine.
Yep, the green machine. What else? Anything? The big green.
Oh, there was I feel like there was one more.
The reason, so Dr. Matt calls this the infragreen. Infrared, so this technically right now, and you can see the green, this technically right now is on infrared wavelength. So this laser is producing infrared. Infrared is outside the visible spectrum, so you cannot see it. The laser will produce a small amount of visible light, and the visible light that this laser produces is green. So it says, hey, this laser's on, you're covering this much surface area, you're pointing it here. Yes, the laser is running and it works. But when people use this, or when people see this, you're like, what's the green do? I'm like, well, I'm actually using infrared. And they're like, infrared? What? It's so easy to connect the dots between red and infrared, but infrared's invisible. You can't see it. And so
it's a guide light.
Yeah. So both the green, which this starts in, the green appears much brighter. Green and the infrared both appear green on here. And so for those of you who have this or use this in clinical practice, when I turned it on, I was like, well, yeah, does this thing work? And I'm thinking, okay, yeah, it does work. And so if someone has an LZ30, which is red and infrared, the infrared appears red. It's just not as bright. It's very similar. So yeah, I should have opened this up with Abby's amazing, which I did say, but also I've had times where I've had really stubborn reflexes. Do you remember this? This is a year and a half ago. And I'm like, hey, Abby, can you fill in for me? I had to go adjust someone or talk to a parent. And by the time I came back, the reflex I'd been working on for 4 days was gone.
Yeah.
And so, well, good, you should. And so, and just this, obviously we're talking about green, talking about lasers, but as a staff, you, all of our therapists, you're just so amazing. You have so much experience. You bring so much to the office. And so thanks for what you do.
Thank you.
I'd be honored to have my kids see you. I know they would be in good hands. I know when kids are working with you that they have better care than I could ever even dream of providing, just the way you connect with them and have fun with them. Thanks for what you do. And I appreciate your time sitting down and talking about this with me.
Yeah, of course. Thank you.
Look forward to keeping going here.
Yeah, me too. It's been a joy. Thanks.
So whether you're a parent or a provider and you want to help your kids or your patients and you want to learn more about how to help them with laser therapy, schedule a call with one of us doctors here at Infinity, because we really can help because we can really help guide you and make a more informed decision, selecting the right laser for your child or your patient base. Different lasers are really beneficial for different reasons. And so through a brief discussion, we can really help you identify what's going to be most appropriate and really what's most beneficial for your kids or your patients. So schedule a call with one of us and we'd be happy to help.